So Rachel, I'm super excited to speak with Jennifer Fink because she is literally going to introduce us to what seems like the iPhone camera for your cervix. Very, very interesting and high tech.
And one of the consistent themes we hear very frequently from female founders who have innovated in the space is they're really quite concerned. And I'm not suggesting other entrepreneurs aren't, but a consistent theme we hear is how do you make a healthcare situation, which already might be fraught with anxiety or concern and fear, how do you make it easier and better? And so what it sounds like from our conversation, I'm excited for people to hear, is that Lutech Medical is really focused on doing just that in one aspect of the patient experience. So let's take a listen.
Welcome to the Business of the V. Hello, friends and colleagues. I'm Dr. Alyssa Dweck.
And I'm Rachel Braun-Sherrill. Each week, we bring you the most fascinating investors, inventors, entrepreneurs, academics, and healthcare practitioners who are making things happen in women's sexual and reproductive health.
If you are a woman, know a woman, have a business, or care about your V health and wellness, fasten your seatbelts and listen in to another informative and inspiring episode.
We are so happy to welcome our guest today, Jennifer Fink, who is the Chief Strategy Officer at Lutech Industries, which is described as a woman-owned and operated medical equipment company that innovates women's health procedures. So mouthful and a big goal. Welcome, Jennifer. We're so happy to have you.
Thank you. I'm so happy to be here. I have been listening to a bunch of your episodes and I love what you guys are doing. I love the people that you have on the show and what everybody's talking about. I think it's a really exciting time in women's health. And I think that you guys are really, really kind of like showcasing that. So I think awesome to be here. Thank you.
Well, we appreciate that.
We sure do.
We want to give you the chance to tell us a little bit about yourself and your origin story and how you came to be at Lutech. So what was your path? We always find these parts of the conversation so enjoyable when, people come from the Air Force and then decide that they want to, create condoms. There's just very random ways that people get into women's health. So tell us a little bit about you and how you came to be Chief Strategy Officer at Lutech.
Sure. So I wanted to be a history teacher, a high school history teacher. That was my goal. I'm from Long Island. I went to college in Manhattan. And while I was in college, I ended up working at a restaurant and managing the restaurant, and then abruptly just quit, even though I was going to go to school, continue on and do like a Teach NYC. That's kind of what my goal was. But I ended up in a sales role for State Farm Insurance, and that just kind of progressed me down the line of sales, which I loved, relationship building. And about 8 years ago, so this month, 8 years ago, I was searching for something new, and I happened upon this interview and I met the CEO of Lutech. Her name's Liana Vakula. And I just connected with her and I loved what she was doing. She had recently inherited this company, Lutech, from her father. It's a small family-owned company, startup at the time. And they had experience in patient monitoring and colposcopes. And they were about to receive FDA approval on the first high definition digital colposcope. And that would be the first time that high definition technology is used in this device.
So I'd like to just jump in and tell our audience what a colposcope is, because it's not a commonly used word. So super quick. We all know the term pap smear, which is a screening test for cervical cancer. When a pap smear shows the potential for abnormal cells, we use a special microscope that allows us to look at the cervix under magnification, and it's called a colposcope. So please resume.
Yeah, definitely. That was a perfect way to put it. So this was the first high definition digital colposcope. So back in like 100 years ago, I guess, basically, I think it's 93 years ago, the first colposcope was made, and it was just a large microscope that was kind of huge and stayed in the exam room. And in the late 80s, a company used video technology to try to see if they could digitize colposcopy, but because the technology wasn't there, the device didn't take off, and it was kind of moved to the side. And then as camera technology became more readily available and companies like Sony were creating more high definition technology, a lot of medical equipment started incorporating this kind of technology. And so we did with the colposcope. And so that's what I was brought on to do, was to introduce this first of its kind high definition technology into the colposcopy space and into forensic medical exams, which are exams that are done after a sexual assault, to collect documentation and provide medical treatment at that time. So that's kind of my story of how I got to be with Lutech. So it's been 8 years, and it's definitely been a journey.
It sounds that way.
Where's the company today in terms of commercialization and acceptance in the marketplace?
Yeah, that's a great question. So when I started, it was very challenging because there was already this kind of previous device that had left gynecologists with a negative experience. And so they didn't really believe that digital colposcopy was going to ever take off. So it's been a challenge, but I think probably year 3, things started picking up a little bit more. And then we were seeing a lot of growth before COVID, and then COVID happened, of course, and all elective procedures stopped. So there was kind of a lull there. But since then, I think COVID has really, the positive is that it's really brought to the forefront telemedicine and telehealth services and digitization and what possibilities are out there. So I think that that's really kind of been something that has moved us forward. And I think understanding the capabilities that come with digitizing technology, like image capture and sharing data, and, on the patient side, so many things. So I think now we're at this like prime spot where it's really being embraced in a way that it kind of wasn't before COVID. And it's really exciting.
Yeah, I'm going to jump in about my clinical experience with colposcopes, which of course, these are exams that I do every day. The thing is that I can see benefit on both the patient side and the practitioner side. So, colposcopes these days are not the most ergonomic instruments. So we often find ourselves like totally contorted, trying to see properly and aim the light properly and get the right magnification. And then, of course, directing biopsies is even more challenging from an ergonomic standpoint. So I'm guessing that your equipment is going to mitigate that. Number 2, if things are so much clearer and so much easier to perform, this would be a shorter procedure for patients who, of course, are mortified when they see this big microscope coming wheeling it down the hall and into the room. With that said, I have a question for you. Obviously, COVID lessened the number of procedures we did. We were really not even in office. The new guidelines that are not that new anymore for cervical cancer screening are doing everything in their power to eliminate colposcopic exams. So, have you seen an impact about that, or not really? For example, Pap smears were always once a year, for as long as we can remember. And I'm dating myself a bit, but of course, in practice, probably over the past 10 years, Pap smears are now every 3 to 5 years for women, 21 until 65, with certain factors to be taken into account. This is a lot less abnormal Paps that we potentially would find, and therefore a lot less that would be recommended. Are you noticing that in your company?
It's a really good point. I think there's definitely 2 schools of thought about it. I think there's one that feels that colposcopy is kind of an outdated procedure. And then I think more mainstream is that it's still really beneficial. And I think even, if you think about it outside of the US too, right? Like cervical cancer is the #1 mortality causing cancer in women worldwide. So, and it has a 90% cure rate if it's detected within the first 10 to 15 years. So that data really tells you something, right? It says that nobody's looking at the cervix or nobody's testing the cervix. And so there's kind of a large opportunity there to use a colposcope or, visualization as a means to impacting those death rates. And I think it's still possible. I think it's kind of like there's a lot of new technology, right? There's screening, there's colposcopy, there's a bunch of things, but I think there's room for impact from everything.
Yeah. I guess the U.S. hopefully is doing something right, since it is the 4th most common cancer in U.S. women. Yeah. Not that anything wants to be 4th in this particular department, right. But we're in a good place, I guess, compared to the rest of the world.
I think last year there was a statistic that death rates from cervical cancer in the U.S. are actually on the rise again.
Yes.
And they were evaluating whether those guidelines needed to be modified again. So, maybe it went too far in one direction, or there's kind of like a middle ground somewhere in between where we are and where we were.
Yeah.
So given the nature of the product, my assumption obviously is that you're selling to healthcare practitioners. What has been the response, or if you can give us any sense of, how broadly practitioners are using this now? And are they using it as a full replacement for what they were doing before?
Yeah. So, it's definitely a full replacement of an optical colposcope. It has become widely used. I say that we are approaching the #1 colposcope that's purchased here in the US.
Wow.
I think the advantages, one of them is, we touched on this before, but the patient experience. There's something that I always think about, like you go to the gynecologist and the nurse says, okay, so you can take off all your clothes and put on this robe. And then you take your clothes and you like delicately fold them and make sure you put like your underwear and your bra underneath your shirt or your pants. So you have like some, it's a sign of trying to have some kind of control in this like extremely vulnerable situation, even though you know that it's absolutely ridiculous because what's about to happen. It's like there is no privacy in this setting. But I think that says a lot about how women feel in that situation and how vulnerable they feel. And I think that there's an opportunity in medicine right now and women's health for technology to kind of improve the experience that women have in that situation. And our colposcope definitely improves that. So, instead of this large microscope that's placed in between the provider and the patient, where the provider has to lean their face in and kind of like hunch over, they're very, very close. This widens that gap. So now they're able to sit up straight in a different posture that allows them to assess what's going on with the patient, maintain communication, and their face is not as close. And then it provides also the opportunity to educate the patient. So it's a camera that's connected to a computer, but it also can display on an alternate monitor that can face the patient. And so it can be really a good opportunity to educate the patient and provide the patient with an opportunity to learn about their anatomy and to see the inside of their body, which has been really well received and shown to improve follow-up appointments. I think it's more engagement.
Yeah, I'm just wondering what's up with some of my patients who absolutely throw all their clothes all over the floor. So I'm not sure I'm going to have to do some teaching about the neatness and control factor in my practice. Kidding. Right? My patients are wonderful, but I do laugh when I'm stepping over underwear and socks and all of that. In any event, the other real benefit that I see, since we really all rely so heavily on electronic medical records, is the ability to upload these images. So again, not to date myself, but I came from the time where we used to draw a little picture of the cervix and, pick out areas to make little notations and pictures. My question for you is, how are biopsies directed when you're not using this microscope? Is it all pretty much done in the same way, but now you're just using this camera instead of a microscope? So here's today's hot flash. The American Cancer Society suggests that in 2023, 13,960 cases of invasive cervical cancer will be diagnosed, and 4,300 of those people will die from cervical cancer.
You got it exactly right. Yep. Everything is exactly the same. You're just in this different position. So you're able to, instead of using the eyepieces and removing your glasses, you're just sitting upright and using the screen and the larger computer screen. And then you can capture those images hands-free. You didn't date yourself too much with that. A lot of programs are still drawing, which is what makes, moving towards digital colposcopes even more appealing, because it's so outdated. And then the process that has to go with that document that you write on has to be scanned in by somebody. Mm-hmm. And that involves a lot of time and effort. So moving images, sometimes not even manually, there's automatic ways to do it now where it just gets swept right into the EMR, the electronic medical record, just like you were saying. And that's great, because then you can reference it later in that 3 years when you're doing that follow-up. You can see the progression and what's changed. And that's a great tool.
Do you have testimonials about from doctors or patients, like, this changed my life? I'm one of those crazy people who loves going to the dentist. So are people now saying, I don't dread getting the annual exam, or a doctor saying they really feel that there's a different interaction that they're having with their patients?
Definitely. So we have limited access to the patients, but the feedback that we receive is it's just a shorter, easier exam. And that it really provides an opportunity, a teaching tool, and a way to really connect with the patient, I think, and educate them. So yeah, we receive a lot of feedback on that. And there's a bunch of testimonials on our website.
So the gynecological oncologists, these are the people who, of course, are, really seeing the most complex cases and some of the more difficult, challenging cases, because I'm feeling like I have not really heard about this piece of equipment in just the random community doctors' offices. I wonder if cost has something to do with that coverage, or if it's catering to specialists.
Interesting. So I feel like gynecology, oncology is not so much an area that we've really dove into yet. We are more in the community health, the private practice, or the larger institution, some surgery suites. Like Johns Hopkins has a surgery suite where they refer patients who maybe have a lower tolerance to pain, and they do the procedure under anesthesia instead of in the office setting, and they use our colposcope in that facility. So it's really widespread. Cost-wise, it's about the third of a cost of an optical colposcope with image capture capability. So it's a very cost-effective tool. And we have 2 versions of it. I don't know why we haven't kind of crossed paths before. Maybe we haven't been, we exhibit with ACOG, ASCCP, and they're amazing. They do 3 hands-on training courses a year all across the country to bring on new colposcopists and train. And so we work with them, and we provide training in those programs. So I'm not sure. Maybe we just haven't, maybe we need some more marketing.
I'd like to see you in my area. For those who don't know. Located? Oh, I'm in New York. That's why I asked. Yeah.
Maybe that's because we are in New York. So it's kind of slowly growing.
So when you talk about the price and it's cost effective relative to the the optical colposcope you talked about, just for people who have no idea what that means, what range are we talking about and how is it paid for? Is it paid for by insurance? Is it paid for by the practice and then reimbursed with insurance for each procedure? How does that work? And is it adding a benefit to the physician in that way, in terms of maybe they can look at more patients in a day, maybe they can diagnose more quickly? What is the sort of economic upside, if you will, to the doctor and the treatment benefit to the patient?
Great questions. So optical colposcopes with a camera attachment generally run about 12 to 15,000. And our colposcope, so we have two models. We have the higher end version, which is 7,300, and that includes the device, the stand, and the software that's needed to capture the images. So pretty much everything in a 3-year warranty. And then we have a lower end model that is really, it still uses a high definition camera and lens, but it's a less expensive version of that. And we generally sell that version for 4,300, and we sell that more in the sexual assault space because most of those programs are highly underfunded and they have a difficult time getting money for equipment. So, and obviously it's very important piece of equipment to be used in that setting. So we really try to keep it as cost effective as possible for that space as well. So that's kind of the price. The device uses the same, they're called CPT codes for different exams as an optical colposcope. So they are, those exams are paid for by insurance, and they're reimbursed the same way as they would be with an optical colposcope. And I don't remember if there was what other part of the question you asked.
No, you got it.
You got it. And how does the business break down in terms of emphasis? You said something that I think is really important, is thinking about the patient experience. And if COVID has had some positive benefits, I think, on women's health in terms of awareness. So the idea that this was founded by a father and inherited by a daughter who's really focused on making the patient care experience better is critical. When you talk about using it in the context of trauma, it becomes even more important. Is the actual level of intrusiveness, for lack of a better word, is the experience less something? Is it somehow better? Not like it'd be good. Less traumatizing. Thank you.
Yeah,
is the experience
definitely
less traumatizing using your colposcope in the areas of trauma and assault?
Sure, that's a great question. So if you consider, we work with a lot of child advocacy centers and sexual assault nurse examiners who are referred to as SANE nurses. So oftentimes when there's issues relating to, child welfare, pornography, things like that, a lot of that initial trauma involves the use of cameras and cell phones. So to introduce a device that a lot of sexual assault nurse examiners refer to as like a fancy flashlight, something that is not familiar in shape and design to standard camera equipment, it really kind of eases the situation. They also use that as well as an education point, especially, at a certain age group. And then, documenting debris and bruising and all of the things that they capture in an internal exam and having it done at a greater distance so that the provider is not in such a close proximity to the patient is really important. And it really allows that trauma-informed support during the exam and really facilitates that much better than, your standard digital camera or high powered camera equipment or cell phone would?
Mm-hmm.
That was a great question.
Well, it's amazing and complex and simple at the same time. That's one of the things that sounds so cool to me. I mean, Alyssa would be much closer to the experience of using one. I've only been on the receiving end, but the idea that it's a sort of gentler, nicer exam for what I would call more regular situations where you're just going in for either your annual or you went in for a particular problem, and as well as the incredibly sensitive and important use case for victims of assault or trauma. So it's so exciting. We can't wait to continue to watch your progress and really doing something to help make women's health better, easier, and more comfortable.
Yeah, great job. Great work. Thank you so much for joining us.
Thank you. Thank you for having me.
Our pleasure. We'll see you soon, and we'll let you know when it's ready to drop.
Awesome. Thank you. I hope it was good. And thank you both for everything that you're doing. I can't even say it enough. I think that it's just amazing this time we're in. And I think that there's a lot of opportunity and possibility. And I just love that you're showcasing all of these awesome things that are happening. It's really great.
We always say we have the gift of gab when it comes to talking about this stuff. So we're working it, and we're grateful that Sal introduced us. Have a great evening.
Definitely.
Yeah, you too.
Terrific. Bye, Jennifer. Have a good evening.
Bye.
Don't forget, subscribe to our podcast at businessofthev.com for the latest trends and trendsetters in women's health and business.